video looks at the dot point health as a social construct. Your syllabus asks you to recognise the interrelationship of the determinants and to challenge the notion that health is solely an individual's responsibility. It also asks you to investigate how the determinants of health explain why some individuals and groups have better or worse health than others. Let's start by stating that health is not a result of individual choices only, but is actually constructed by society, and as such, responsibility for health falls upon not just the individual, but society as a whole. Health as a social construct recognises how an individual's context impacts upon their health status. It affirms the interrelationship of the determinants of health and notes that many of the determinants are either out of the individual's control or made difficult to change because of their context. The result is that health is the responsibility of society and not just the individual. Every determinant of health affects another, often more than one. The four categories of determinants overlap with one another as they interrelate to determine the health of an individual. For example, your geographical location can limit or increase your employment and educational options. It can also improve your access to health services, affect your peer group, and media exposure. Furthermore, socioeconomic factors can determine your peer groups, as you may or may not be able to afford to do the activities around which people socialise. Your education can affect your income and your access to health services and technology, especially when considering elective surgery or ancillary care. Your family will at various stages affect your health by influencing your peer group, income, geographic location, your genetics, your attitude towards health, your religion, your access to technology or health services, and so much more. Finally, individual factors such as knowledge and skill levels will greatly impact your choice of employment, can affect your level of education, can then affect your geographic location and ability to access or navigate the healthcare industry. Recognising the interrelationship of the health determinants is acknowledging that health is a more complex issue than is often thought. The fact that some health determinants are non-modifiable means that our health is affected by things beyond our control, and therefore we are not entirely responsible for our own health. But this does not mean we have no responsibility. As we progress in life, our degree of control increases, and we are responsible for the determinants that we can modify, especially those that are more easily changed, such as our health behaviours. This complex nature of health shows us that health is a social construct and challenges the notion that health is solely an individual's responsibility, and helps explain why some groups have better health than others. This simple image helps explain why people who have a socioeconomic disadvantage have poorer health outcomes. Being born into a poor family usually results in lower levels of education and limited skill development. This limits job opportunities and income. These limitations result in poorer living conditions, less access to health services and technology, and lower levels of health knowledge and skill. The result is that the individual lives in an environment less conducive to good health and is less equipped to make the right health choices.